Okay, I might get started given that we don't have a lot of time this morning and I'm sure everyone's very busy. So thank you for attending this morning to those who have come along to this live session. My name is Pippa Rose from SuperFriend and I'm joined by Rebecca Pryor from MindFrame. On the outset, I'd like to acknowledge the traditional owners of this land that we meet on today and pay my respects to their elders past, present, and the elders from other communities who may be from other places here today. So firstly, just a bit of an overview of SuperFriend, and Rebecca will be doing her presentation at the in about half an hour, and she can introduce MindFrame then, I'm sure you're all familiar with. But SuperFriend is a national mental health organisation influencing positive change in workplace mental health and wellbeing. We're an industry super funds initiative and primarily focus on workplace mental health solutions, insights and advocacy. So today I'm going to cover the topics that I've got listed here on the screen. So a bit about understanding mental health, particularly in relation to some of the challenges that we're all experiencing today in the current situation with COVID. Talking a bit more about work and mental health, particularly looking at from the perspective of working remotely and also in a time where there's some job insecurity as well, and some of the things that you can access to support through that time. The importance of looking after yourself and then some useful resources. We don't have a lot of time today, so if there are any questions, we will be looking at the chat forum and providing some follow-up information via your email address after. So please, if there are any burning questions, pop them in there and then we can answer them at a later stage. So firstly, just want to set the scene by talking a little bit about mental health and the difference between compromised mental health and positive mental health. Often when we think about mental illness, mental health, we often think about mental illness, and you know, it's important to understand that mental health, like physical health, is something that we all have and is something that we need to work at to stay in a positive frame of mind. Before we go into too much around that definition though, I think it's important to look at the bigger picture in terms of mental ill health within Australia currently. At the moment, latest statistics indicate that approximately 1 in 5 people will experience a mental health condition in any year, and approximately 45% over their lifetime. And tragically, approximately 8 people end their life due to suicide every year as well. And as we all know that, you know, this impacts all aspects of communities and is a tragic situation. So the more that we can learn around mental health, looking after ourselves and supporting those around us, we can work towards trying to minimise that statistic. I think surprisingly as well, you know, it's only about 60% of people will not seek treatment for mental health conditions. So again, by increasing understanding and literacy around, you know, signs of poor mental health, it can really help promote help seeking and allow people to access support that they might need. So looking at, I guess, referring back to that definition before and the statistics, you know, 1 in 5 people will experience a mental health condition in any year, but it is important to understand that all of us have mental health, and when we are looking at the strategies that I'll touch on later around self-care, this is really important for all of us. Like physical health, you know, we need to exercise, eat well, adequate sleep, hydrate. All of those things help us keep in positive physical health, and also help with our mental health. And there's certainly some things that we can do on a daily basis to ensure that we do stay in that positive space in terms of our mental health. And I think this is really reinforced when we look at the World Health Organization definition, which looks at the definition of mental health as being a state of wellbeing in which an individual can realise their own abilities and can cope with normal stresses of life, work productively, and can make a contribution to his or her community. So it's not really about you know, always feeling, you know, on a constant state of up or happy. It's about being able to cope with what life throws at us and having the strength to then bounce back and access those resources as needed. So I'll just show this short video just to reinforce the concept of the mental health continuum, which I think is a really good way of putting some of those concepts into a framework.
I think there might be an issue with the sound of the video. Can anyone else hear the video?
Oh, sorry, I wasn't aware that wasn't, you couldn't hear the sound of that. Look, I'll continue on, and what I can do is send a copy of the video with the sound. So apologies for that. Here I am listening to the video, and yeah, you guys are just watching some pictures. So apologies for that. I'll explain a little bit more in this diagram. So one way to explain the difference between mental health and mental ill health is to think of it in a continuum. And this is a model that was developed by Corey Keyes. So what essentially it's around that we all move as individuals through feelings of this continuum throughout, sometimes throughout a lifetime, sometimes throughout a daily basis, in terms of feeling that we are, you know, have positive mental health and we feel able to cope with things that are thrown at us. And then sometimes, you know, we can look at approaching that poor mental health stage and start having those observable behaviours, poor sleep, feeling anxious, low mood, and that can fluctuate. I think what this also really reiterates is that you can have positive mental health while still having a diagnosed mental illness. So there's, you know, many people functioning, be able to productively work and participate in life activities whilst having a diagnosable condition. So it's really to reiterate that, you know, it's all about maintaining that positive mental health even with a diagnosed condition. And likewise, you can have low mental health without having a diagnosed condition. And there's many things that impact the way that we can interact with our, in our workplaces, with our family and communities that impact the state of our mental health. So what I will do is send a copy of that video out to you all, because it is quite a good one to sort of capture those concepts. So looking at that continuum and some of the observable behaviours that we might see either or note in ourselves or in others, when we might move throughout that continuum of feeling positive mental health right through to being having poor mental health. So, often, understanding these things in ourselves and others can really be a first point in having that awareness that we might need to change some of our behaviours or seek some support elsewhere. So really, it's not about, being able to diagnose someone or having that clinical perspective, but it's really important to have that awareness so that you can, I guess, approach someone if they might be displaying some of these behaviours, and then point them in the right direction to be able to seek support. So, things that indicate when we're feeling healthy, I think we all know that there's, certain things in ourselves. We're sleeping well, we're feeling physically and socially active, where our performance at work is good. We feel that we're comfortable in, family relationships, social relationships. Often, there's some signs when things might be not going so well. And that we might need to change some of those behaviours in ourselves and start to implement some self-care strategies. So things like being irritable, impatient, nervous, sad, increase in worrying, having a bit of a low energy, sleeping. Then we all respond differently to different stresses. So, I think having that awareness in yourself and those around you can really help identify when someone might need to seek some additional support. As obviously it goes down in the spectrum, there's an increase in some of those observable behaviours. So withdrawing socially, having more disturbed sleep, feeling that prolonged sadness or anger, anxiety. And, when there might be something that you need to seek additional support, potential diagnosed condition, when these things last for an extended period of time, and there's some significant issues with emotions and thinking, feeling overwhelmed, and fatigue, panic attacks, things like that. So some of these observable behaviours, I think often, what's going on in ourselves, obviously, we're the only ones who can identify those, but with those around you, it's important to note that some of these things can be an indication that someone might need some support, and that there are some things that you can do to reach out and get that support. So at the end of this presentation, I will be providing some links and information where you can seek some additional support. Okay, so now we've gone through, I guess, some of those basic definitions around mental health and mental ill health. And now I want to talk a little bit around some of the particular issues that we're all facing at the moment in terms of the coronavirus and how that's triggering some particular mental health issues or challenges. So, I think it's fairly normal that we are feeling that there's lots of things outside of our control at the moment. There's concerns around job security, feeling lonely, fearing for our health and our loved ones' health, having feelings of hopelessness. And I guess it's, what I do want to say is a lot of these feelings are very normal, and that, having these feelings are something that we're all experiencing together, and there are some strategies that we can put in place to help minimise some of these feelings at the moment. It is important, as I mentioned before, that each person is experiencing this in a different way due to lots of different circumstances. And as humans, I think we're naturally feel uncomfortable with change, and particularly when things feel out of our control. So I just want to talk a little bit around the concept of resilience and coping, and how you might be able to use some of this model to help you support in feeling that you are able to cope with some of the challenges that we're experiencing at the moment. So I think we hear the word resilience bandied around a lot, and just want to, I guess, reinforce it's not around being strong or weak, and it's not a fixed state. It's something that we can develop through various strategies. So resilience is the ability to, I guess, spring back or bounce back from or adapt to adversity. And there's lots of research to support that, that most people, do with skills and support can bounce back from stress and crises and situations like we're all experiencing at the moment. So one of the biggest things that we can control to support our developing resilience is the way that we think about certain situations. And a model to consider is the ABC model of resilience. So this is really around trying to how we interpret a situation and explain that to ourselves, and using our inner narrative, knowing what's within our control, what's outside our control, and then responding to it in a positive way. I think a good concept to reinforce this is the idea of the locus of control. So this is a model that looks at how our internal narratives or control or lack thereof shapes our attitudes and behaviours during normal times and also in times of crisis. So the theory looks at the degree in which someone believes that they're in control, and that how that then determines their attitudes towards difficult circumstances. So someone with an internal locus of control believes that events happen to them, and that they've got a degree that their choice and the consequences they have an influence over. And at the other end of that spectrum, someone with a strong external locus of control really thinks that things that are happening to them are completely out of their control, and they don't have any influence in that. So I think when we think about this in relation to the current situation, the COVID-19 pandemic has caused a lot of anxiety and despair around the world. And, there's lots of things that we don't have control over. But there are certainly some things that we can put in place to make us give that sense of internal locus of control. So things like the way your attitude, the way that you're absorbing information around you, the way that you're looking after yourself physically and mentally, the way that you might be behaving towards others in terms of supporting people who might need extra assistance, being grateful for the things that you do have. And there's other things that are obviously outside our control, and being aware of that, I think, is really important. So, we don't know how long this is going to go for. Practicing social distancing is something that we're likely to have to continue for a period of time. Things that the government might make decisions over. There's many things that we don't have control over. So I think that model can help to apply to this situation and help us, choose the way in which we respond to a situation that essentially we don't have a lot of control over at the moment. So just want to go into a little bit around the workplace and the mental health, particularly in the situation that we're experiencing at the moment. I think, with the audience here today is obviously looking at the media industry, and I know that there's probably two main issues that we hear in our workplace that are currently impacting people in a lot of different industries, as well as the media industry. So one of those is work from home, and the other one, I guess, is job insecurity and some of the financial stress that's going on at the moment. So before I go into those two aspects, just to talk about work and mental health, we know that good work and being involved in good work is really positive for our mental health. It promotes positive mental health in lots of different ways. And, you know, there's lots of aspects of work that are positive to our mental health. And I've listed those in the table, in the blue table to the left. So things like supportive leadership, having a clear role, clarity and expectations, that sense of social connection, sense of belonging, having support. And then there's aspects of work that can be risks to our mental health. So they're things like excessive stress, poor leadership, lack of support, workload, and we'll provide you with a copy of these slides afterwards, but they're listed there. So I think this current situation has probably tipped some of those out of balance a little bit, and it's important to think about that when those detractors or those risk factors are more apparent, that we need to put in place or need to work towards those promoters and those positive aspects where possible. So I know with working from home, you know, some of the detractors such as or the social connection is decreased, you know, that blurred, you know, work life is present. You know, difficulty switching off when we're sort of all in the same environment, doing, probably not exercising perhaps as much, being more sedentary, lots less of collaboration, spending more time on screen. So there's a number of different things that you know, we're seeing as being potential risk factors in this situation. So trying to, I guess, focus on those things that you can control when working from home, and trying to make work, you know, from home work for you in this situation is really important, particularly around, you know, building routine, trying to schedule exercise in, taking breaks, having time to switch off, staying in regular contact with colleagues and also those around you in terms of friends and family, are really important to help try and minimise those risk factors that we're seeing at the moment. So another issue that we're hearing a lot of is that, you know, many people in Australia have found themselves out of work or under financial stress as a result of COVID-19. And like lots of industries, the media industry has been impacted as well with this situation. So I just want to acknowledge that, you know, dealing with financial stress or losing your job, no matter how or why it happens, and having your income unexpectedly reduced can be really challenging, and it obviously can take a toll on your mental health and well-being, as well as those around you, relationships. So dealing with that, you know, is very difficult, and I just want to acknowledge that, you know, seeking support and, you know, looking at options is something that should be encouraged. There's no, you know, shame in asking for help or seeking support at this time. So there's a number of different sort of things that you can look at in terms of various entitlements, looking at contacting your bank to see if there's some arrangements can be made in terms of repayments, seeking some particular financial advice, and there's a lot of support options both from a financial and a mental health perspective. So there are some great resources that I will provide in the follow-up email to this webinar, so that it'll provide you with further information around those, but really want to encourage that if you do find yourself in this situation to seek support, and that there's yeah, lots of options for you to get that help. So before I pass over to Rebecca, I just wanted to focus on the importance of looking after yourself and self-care. So, no matter what a situation, if we're finding that we're, we're experiencing job loss or being out of work, or even if we've got some stresses in relation to working from home or other life situations, there's always things that we can do that are in our control to support self-care activities. And we know that, implementing these activities is really important in supporting our mental health and our physical health, which helps with that resilience and boosting our feelings of well-being. So the 5 ways of well-being is a good model to think about the various things that you can engage in to support your well-being. These 5 ways it's from the New Economics Foundation in the UK, which is they were developed after some significant research into the different factors that can support our well-being. So I think for many years there was a focus on sort of the negative and illness, and now we do hear the word well-being a lot. And I think the strategies that are encompassed in the 5 ways of well-being, they're all things that we can do at no cost, and are all evidence-based in supporting and improving your well-being. So the 5 ways of well-being, the first one is connect, which is all around connecting with others around us. And we've got some suggestions in the box. Again, I'll provide you as a follow-up resource around things that you can actually do whilst we're restricted with some of our social activities, or engaging with external or outdoor activities. So with Connect, it's around reaching out, supporting our family and friends, and also doing things to keep up that connection, which I know can be difficult when we are at home. Keep learning is all around keeping our brain curious and engaged with the world around you. There's lots of different things that you can do to support this aspect of well-being. I think there's lots of digital options, various things around language or musical instrument, or doing an online course, or lots of different things that you can do to keep that learning aspect engaged, and that curiosity going, which is a great way to maintain well-being. Take notice is all around being aware of what's going on around you and focusing on the present moment. Some people like to do more structured sort of mindfulness activities, but you don't even need to do that if you're not comfortable with doing mindfulness. So it just can be when you are outside, noticing the garden around you, the neighbourhood that you're in, taking time to thank someone, reflecting on daily things that you might be grateful for. Just having that time to notice and concentrate on the present has really been found to improve our well-being. The 4th one is staying active. I think we hear this a lot, personally, I guess, from a physical perspective, but there's lots of research to support the importance of physical activity on our mental health. So, I know with gyms and other formal sort of sports activities, hopefully will be re-engaged soon, but there's other things that I'm sure we've all been trialling out in this time to help keep that activity going, and you really do find that engaging in a short amount of activity, it doesn't have to be sort of full, sweating, high intensity. Even a walk, engaging in dancing or Pilates or something less, yoga, is all really positive from a physical and a mental health perspective. The last one is around giving and gratitude. So it's such a simple thing to do, and it really, there's research to support that it does have a positive impact on our mental health. So giving compliments, sharing or supporting someone who might need some extra assistance. I think we've seen a really positive shift in this situation around neighbours and neighbourhoods banding together and supporting people who might not be able to do their shopping, for example. So all of those simple things really do not only help the person who's receiving that, but also help you as the giver in improving your well-being. So I'll share those with you, and I'm sure you've got your own ideas. But they're all simple things to do, don't cost anything, and can really help keep you in a positive frame of mind. So I'll pass you over to Rebecca, but just wanting to think about what's one thing that you might do from that list to help commit to and prioritise your own mental health. I know with so much going on, often with kids at home or looking after people that need caring in your life and work, it can be hard to put yourself at the forefront. But hopefully you can engage in one of those activities and help with your mental health and well-being. I do have some resources that I've got in the other slides, but given time, I'll pass over to Rebecca and I can send that out in the email following. So thanks, Rebecca.
Fabulous. I will now just try and share my screen. Okay. Is that working?
Yes.
Fabulous. Great. So I just want to thank everyone for taking the time out of their day to come along to the training today. I do apologise. Usually this training is much longer and would go into some of the content in much more depth. However, if there is interest, we are running some additional training sessions that would go a little bit longer. But this is a nice taster into, what MindFrame is and how we might be able to assist you during this time, but also moving into the future if you're looking at reporting around mental illness and suicide. So for those of you who are not familiar with the MindFrame or the work of MindFrame, we are a nationally funded project that works with a range of different stakeholders to ensure safe communication about mental illness and suicide. So we've been working within this space for around 15 years. And we do this in a variety of different ways. So providing leadership within the sector, building capabilities of the sector. Something that you may or may not know is that across the world there are media guidelines on how suicide and mental illness should be reported. However, in Australia, we are the only country that actually has a team that goes in and provides education and training like this that is able to provide kind of individualized support or more kind of content than just having those guidelines sitting on a website. So that's really, really great for us and is a support that you guys are more than welcome to access. So before we move much further on, I do just want to flag that suicide and mental illness are legitimate topics that need to be discussed within the media. Unfortunately, sometimes when looking at the MindFrame guidelines around safe reporting, there is this misconception that we are wanting to censor what people are saying or stop people from talking about suicidal mental illness. This isn't the case. We are actually wanting to increase these conversations, but we're just wanting to make sure that those conversations are safe for communities, especially at times like this, with additional stresses that are happening, as Pippa had mentioned, loss of job or job insecurity or financial insecurity. We're not wanting to kind of put out problematic content that might potentially lead to someone feeling additionally distressed or even taking their own life. So this is kind of a brief overview of the MindFrame program logic. So these are some of the key areas that we work with. So everything from tertiary education. So potentially you may have had a MindFrame guest lecture during your university studies. We work with a range of different universities across the country and are expanding that into public relations and even some of the allied health degrees. We work with a range of different news media and public relation organisations. So potentially we've worked with you or your organisation in the past. We work with a range of different media sources. So all of those people that you would potentially be going to for your stories. So people that work within the mental health and suicide prevention sector, police, courts, emergency services, different community groups, members of parliament, or other kind of political figures, and especially people with lived experience. And then we also have our fictional and factual portrayals. So looking at things like television production, documentary, movies, online streaming, theatre. But yeah, so if there's any questions about that, more than happy to answer. But this is kind of a bit of an overview of all of the people that we work within. So why is it that we actually need to consider the way that we report about suicide? So our research shows that reporting about suicide deaths is associated with increased rates of suicide and suicide attempts using the same method or location, and increased rates of suicide overall. There is also an increase of copycat behaviour where a story is prominent about a celebrity, the reader identifies with the person, the report details method or location, or glorifies the death. When vulnerable people may be drawn to stories about suicide and negatively impact. I will go into this in more detail and how it is that you can combat that. But I think that the takeaway from this slide is that very last point, that vulnerable people may be drawn to these stories. So when you're looking at constructing something around suicide or mental illness, I guess one of the most important things to keep in your mind is that you don't know who's going to be reading this content. So for someone who is well and has high levels of resilience and has lots of support from the people around them, the story that you're writing might not have the same impact to someone who is feeling vulnerable, who has potentially lost their job, who may be experiencing adverse circumstances because of COVID or just general life circumstances. It's going to hit in a very different way. So always keeping that vulnerable person at the front of your mind when you are writing these stories, because those people are going to be the ones that are drawn to content around suicide and mental illness. The example that I like to give as to how that actually works is our brain has a cognitive function that allows us to filter through information. So if you think of when you've went to buy a brand new car or, secondhand car, and you've decided on the model that you're wanting to get, and all of a sudden you're seeing so many different Mazdas on the road, and you're like, wow, I didn't realize that this car was actually so popular. It's not necessarily that this car that you've chosen is really popular. It's just your brain's way of filtering through information. So if people are already feeling a little bit distressed, feeling like they might be a bit of a burden on their family, and suicide is something that they're thinking about, there is a chance that they will be more drawn to these stories than just the general public. So the MindFrame principles look at ways that we can be kind of exploring some of these stories in a safer way. So, considering some of the other risk factors that were mentioned before, to decrease some of that risk, we encourage people to provide context. So giving some additional information about, what is suicide? Why does that occur? Suicide is an incredibly complex topic and situation. Providing some additional information for the community to reduce some of that fear and stigma is incredibly important. Framing suicide as a tragic and avoidable loss. For most of us here, I think that everyone would see it as a tragic and avoidable loss, and making sure that that's coming across in the news pieces that you're putting out. This is sometimes difficult when looking at celebrity reporting. People are wanting to kind of highlight all of the really great things about, their career or their life, but it's also really important to make sure that we are focusing on some of that negative impact that's having on people around them. Again, if we go back to the other slide, people are going to be drawn to that story if they're already feeling vulnerable. We don't want them to kind of see this person elevated to an additional celebrity status because they've taken their life. We don't want suicide to be a desired outcome in any way. So if we can be focusing on some of the negative impacts whilst also balancing it out with, some of the great things about that person, that's really important. Exploring stories of overcoming suicidal ideation. Really important to note for this point that discussing how someone may have made an attempt on their life isn't necessarily what we're talking about when saying, you know, you should explore stories of overcoming suicidal ideation. This is more about looking at how people have sought help rather than how people may have made an attempt previously. So kind of focusing on some of the more positive aspects of someone's story. So, you know, what was it like, you know, having a first psychologist appointment, or what was the process of getting a mental health care plan through their GP? How is it that they got themselves out of that situation, or, you know, sought help from people around them rather than focusing on kind of the doom and gloom side of their story. And then promoting help-seeking information. You know, again, people who are vulnerable are potentially going to be drawn to these stories. So we're wanting to provide avenues for people to seek help. I think it's fairly normal for us to see now, you know, any story that discusses mental illness or suicide to kind of throw Lifeline on. It's not necessarily enough. You know, just kind of whacking Lifeline at the bottom isn't necessarily going to work for everyone. So having a bit of a think about how it is that you could be incorporating different help seeking rather than just Lifeline into some of the stories that you're putting out. Okay, so this is our language card. So kind of goes into some of the stuff that I was talking about earlier. So for the most part, I would say what we're really wanting you to do is have a think about the way it is that you're framing what it is that you're saying. Try to take more of a, I guess, person-centered approach to your language. So if we're looking at the first point, a successful or an unsuccessful suicide, I don't think that any of us would see a successful suicide as a success. You know, someone dying is not necessarily a success, and someone surviving is not unsuccessful. So just having a bit of a think about what kind of an impact language like that could have. The same with the second last point of a failed suicide and a suicide bid. If you have made an attempt on your life and have survived that attempt, and all of a sudden are seeing, you know, people kind of describe it as a failed attempt, you know, you're already feeling like you're a burden, you can't necessarily, you know, do things right, and someone is then saying that you're failed, what kind of an impact could that have? The second point, I think, you know, is a little bit more common for us to kind of hear about now, is we're moving away from using the terms committed suicide or commit suicide for a range of different reasons. So in Australia, it is no longer a crime, whilst many religions still do see suicide as a sin. We're wanting to take away some of that kind of judgmental language around suicide to just reduce some of that stigma. And then sensationalizing suicide. So really, we're looking from a public health perspective. We can't have a suicide epidemic. We're currently going through a global epidemic, but you can't catch suicide in the way that you can catch COVID. Whilst you can have a copycat effect, or you can have a contagion effect, there is a range of different factors that need to be considered before something can be labelled as a copycat suicide or a suicide contagion. But we can't have a suicide epidemic. It's from a public health perspective just not possible. So we would typically encourage, you know, changing that language to increasing rates or higher rates, or in the cases that it was a copycat suicide or a suicide epidemic, using that kind of language. And then the last point on that slide is using suicide out of context. It's the only one that we don't provide a preferred option for. There is no need to use suicide out of context. As media professionals or as journalists, I'm sure you're very aware of the extensive list of different words that you could be using. So yeah, that's our language guide. Again, I do apologise that I'm going through this quite quickly. I'm just wanting to make sure that we get through everything. So then minimising details about method and location. This is probably one of the biggest but also trickiest parts of reporting a suicide. And whilst, you know, we have this set of guidelines and general recommendations, we fully understand that this might not necessarily work for every situation, and there might be times when, you know, it doesn't quite fit into a perfect box, and that's okay. We're more than happy for you to reach out to the team, get in contact with us, and we can workshop how it is that we can make the story as safe as possible. But typically, we recommend against providing explicit details about a particular suicide method. This is due to the potential of copycat behaviour. So, you know, the example that we use is providing really kind of general terms like a mix of drugs, rather than providing the exact drug or the exact quantity of that drug. Unfortunately, we have seen in the past instances where very explicit information has been given through the media around particular suicide methods, and there has been significant increases of that method within communities, which is really unfortunate. This, however, is very different to conversations about means restriction. So, you know, if you are looking at discussing method in terms of means restriction, there is kind of additional considerations that need to be had there. But more than happy to provide that kind of information at a different time. And then reporting uncommon or new methods, again, can lead to imitation. So providing as little information as possible and having a think about why it is that you're actually wanting to include that information. Is it actually relevant to the story, or is it just because people are curious? Describing locations of suicide may also promote these to vulnerable people. So again, providing people exact locations of where a suicide may have occurred can inexplicably give people you know, details around the particular methods. So, you know, if we're thinking, you know, some of the hotspot locations across the country, you know, saying, you know, that someone was found deceased in a particular location may automatically result in people knowing what that method was. So just having a think about why it is that you're actually needing to provide locations. Again, you know, this one's really difficult and doesn't always fit into a perfect box. You know, there might be a range of different reasons why you are needing to include location. You know, if there are streets that are closed down, you know, we've had instances before where in, you know, the CBD of Sydney, people have been concerned that there was a terrorist attack occurring. So for that reason, there is, you know, times that location does need to be discussed within stories, but how it is that we can actually minimize some of that's really important. And then having a bit of a think about the images that you're including in some of your stories. So, you know, unfortunately, I'm fully aware that stock images can sometimes be horrendous. So, you know, depending on how your organization sits or the company that you're working for, you know, if you have capacity to use different images, or, you know, even reach out to some of your local organizations to see if they have some images that they would be happy for you to use. Just trying to steer away from some of those real kind of classic, you know, someone sitting alone in a tunnel with their head in their hands, or, you know, someone sitting alone on a park bench. Is this actually representative of mental health or suicide? And then help seeking information. So as I mentioned before, you know, it's not enough to just kind of throw lifeline at the end of a story. You know, we would encourage you to have a bit of a think about what are some other help seeking options and how can you be incorporating that throughout your stories. So this is one of our social media cards that we're often promoting. You know, you may see online or in some of our media alerts that we send out that you might receive. This is just kind of a stock standard that you're more than welcome to copy and paste from. But, you know, also having a bit of a think about, you know, depending on, again, where it is that your organization sits or who your audience may be, what other help-seeking information could you be offering at this time? So, you know, given all of the complexity that COVID kind of brings around, you know, financial security or insecurity, job loss, could you be promoting some other help seeking that might not necessarily be seen as kind of suicide prevention help seeking, but may actually help reduce some of those risk factors that people was mentioning before? Okay, so why do we need to consider the way that we report about mental illness? So understandably, the media is one of our primary sources for the general community about mental illness. National and international research on mental illness shows that it tends to be negatively portrayed in mass media. Reporting can contribute to negative stereotypes, contribute to stigma and discrimination, but it's really important to minimise some of these negative portrayals of mental illness and start to kind of balance that out with some more positive and almost more realistic portrayals of mental illness. Unfortunately, at least I know from my own experience, you know, sometimes the only time you really see someone that has a mental illness on, you know, like TV shows or, you know, on the nightly news is when something bad has happened. And, you know, a crime has been committed and all of a sudden they're then discussing mental illness, or, you know, something really dramatic has happened on Home and Away and, you know, it's because someone has a mental illness. You know, we need to kind of be exploring more of these stories that showcase that people can live with a mental illness and, you know, not commit crimes or not commit, you know, acts of violence, can live healthy, functional lives. You know, it doesn't necessarily need to be this doom and gloom image that we've previously been painted with in the media. So how to decrease stigma and increase some help seeking. So consider some of the language that you use. So the next slide I will go into, we'll have a look at language. Promote help seeking information. So very similar to the suicide stuff, making sure that you're navigating people towards help seeking. Avoid stereotypes. So, you know, this may mean that you are needing to upskill yourself on what, you know, mental illnesses look like, and some details around, you know, different mental illnesses, but trying to avoid that really stereotypical portrayal of, you know, whether that be anxiety or depression or, you know, personality disorders. Like suicide, mental illness is incredibly complex, and for that reason, it's really important to make sure that we're exploring all of those complexities. Promote stories of recovery and showcase how it is that people can be leading a contributing life despite their mental illness. And applying some specific cultural considerations. So having a bit of a think about how it is that your audience may be consuming some of this information. And if there are cultural considerations, you know, so some of you may be working for, you know, media outlets that are specifically, you know, targeted towards different cultural groups, or, you know, maybe kind of just a more general public, but having a bit of a think about how that may be consumed by different audiences. So again, this is our language card for mental illness. So really just, again, looking at that more positive and person-centered language. So moving away from terms like mental patient, nutter, deranged, mad, crazy, and moving towards language around the individual has a diagnosis of or is living with, just to remove some of that stigma around mental illnesses. Additionally, referring to someone as a victim or suffering from. I think that this is something that we quite often see within the media, if someone is suffering from a mental illness. It's really important to note that whilst someone may be suffering from a mental illness, it's not simply because you have a diagnosis of a mental illness that you are suffering. So, you know, unless, you know, you're interviewing someone with a lived experience and that's the way they're describing their experience, typically we would recommend moving more towards the language of living with or has a diagnosis of, and removing some of that really emotive language like suffering, unless that person actually is experiencing kind of feelings of suffering, essentially. Avoid labeling people by their mental illness. So, you know, in the same way that we wouldn't necessarily label someone by their physical illness, we would say instead that someone has a diagnosis of or is being treated for a particular illness. Avoid using colloquial terms around treatment. basically, this is just, we're wanting to reduce some of the fear and the stigma around seeking help. So, you know, by referring to mental health hospitals as institutions, or, you know, happy pills instead of, you know, using, you know, more medical terms for different medications, or, you know, referring to mental health professionals as shrinks can be a barrier for people accessing help. So instead, we encourage you to actually use appropriate terms like antidepressants or psychiatrists or psychologists. And again, avoid using terms around mental illness or mental health out of context. So the examples that we have on this slide are not the greatest, but you know, it's unfortunately often seen, you know, for some reason, but within sporting reporting, we often see, you know, a range of different mental illness terms used within sports reporting. But again, we have such a extensive English language. There are a range of different other words that you could be using instead of a mental illness term. Avoiding negative stereotypes. So this is basically just, I guess, a table looking at myths and then facts. I won't go through this too much. I imagine that most of this isn't necessarily news to you, but it is really important to make sure that we are considering some of this information when we're putting together stories around mental illness. Our community might not necessarily have the same understanding as we do, and it's really important, your role as a media professional, to be increasing some of that understanding, especially at a time like this when mental illness and suicide is being discussed a lot more in reference to the impact that COVID is having, making sure that we're actually breaking down some of those stereotypes and providing people with as accurate information as possible. Again, our help-seeking card. And then lastly, I would say that these would be my key takeaways for you from this presentation. And again, I apologize for being so quick and speeding through all of this information, but really just acknowledging the fact that suicide and mental illness are complex. So for that reason, reporting on them can be really difficult. And we acknowledge the fact that whilst the MindFrame guidelines provide a very basic overview of how this could be done safely, this doesn't always work on an individual level. So please do reach out to the team. We can read through stories. We can, you know, help you develop concepts. We can fact check information for you. We can, you know, help source professionals if you're looking for, you know, someone to make comment about particular things or provide you with some additional information. We are here to help you make this situation a little bit less complex. It's really important to improve community understanding and reduce stigma. Again, during a time like this, there's a lot of fear within the community about kind of everything, I would say. So just providing some additional information around where people might be able to seek help. You know, what does it look like when someone might be struggling at this time? And then providing help-seeking information. So always making sure that you're navigating people towards help-seeking. I just saw, did someone put their hand up?
I've just, it was Greg has put his hand up. I put allow to talk. I'm not sure if Greg has a question. No.
Okay.
Okay.
Okay, so I also will just let you know that we, as well as our suicide and mental illness guidelines, we also do have guidelines around how to report for alcohol and other drug use. So we are providing training on these guidelines, and they are all available on our website. So whilst, again, want to apologize for speeding through all of this information, but if there are things that I've skipped over or you're wanting some more clarity on, we are running a range of different trainings focusing on suicide, focusing on mental health, and then focusing on alcohol and other drugs. You can find all of this information on our website. So under our news and events section is where you'll find all of our upcoming trainings. You can find more information about the guidelines. One of the other services that we provide is we have a breakdown of all of the current suicide statistics and what that means for Australia. We don't have the same breakdown, unfortunately, for mental illness, but hopefully that's something that we will have moving forward. So if you do have any interest as to what suicide actually does look like for Australia and what our numbers are, something that we would normally go over in training, but is available on our website. Would also encourage, if you have not checked them out before, but having a look at the DART Centre. They have a range of different resources designed for journalists that may be experiencing adverse circumstances as a part of their job. We acknowledge the fact that being a journalist and having to kind of cover some of these topics, you're exposed to all of these things that some of us are trying to avoid. So looking after your mental health at this time is really important. So we have some resources on our page in regards to self-care, but the DART Centre also has a heap more information about vicarious trauma and the impact that can have for journalists. And then similar to PIFA, just really want to encourage you at this time to be looking after yourself. It's it is such an odd time, and none of us really know how to what's going to happen or how it is that we can kind of navigate this space. So would really just encourage you being a little bit proactive when it comes to looking after yourself. The example that we often kind of use is when you're on an airplane, you're told to put on your own oxygen mask before you're putting on or helping other people. So making sure that you're looking after yourself so that you can continue to do your job. And and that is the end of my presentation. So my contact details are there. More than happy for you to contact me directly. Otherwise, through our website is completely okay as well. And I hope that
Rebecca.
I didn't go too much over time.
Greg did actually put the chat in the Q&A rather than the chat. So sorry about that, Greg, but just wanted to know the link between mental illness and suicide. Did you want to answer that, Rebecca, or do you want me to?
Sure.
Yeah, okay.
So understandably, there is a link between mental illness and suicide. And interestingly, last year was the first time that the Australian Bureau of Statistics actually released statistics around how many people that had died by suicide in Australia either had a diagnosis of a mental illness or previously had a diagnosis of a mental illness. So prior to that was kind of a lot of speculation or kind of different people having differing opinions around what that link is. So, whilst mental illness is a risk factor of suicide, it is not completely causal. So there is a range of different factors that could lead to someone taking their life, and mental illness can be one of them. But this doesn't mean that everyone who dies by suicide either has a diagnosed mental illness or experiences signs of a mental illness. And it also means that everyone or anyone that experiences a mental illness isn't necessarily going to think about suicide or have suicidal ideation, if that makes sense.
Thanks, Rebecca. So we've just 3 minutes over the time we said, but and I know we both have, Rebecca and I had to sort of speed through some of the information due to the time constraints. But what we will provide follow-up information with those resources. At SuperFriend, we've got some specific an e-learning module around self-care and COVID, and a range of other things that you can access in terms of if you are experiencing difficulties at the moment or regarding self-care. So we will follow that up. Yes, so thank you so much for your attendance today, and if you do have any follow-up questions, please contact Rebecca or I. But yes, thanks very much. Have a great day.